Assalamualaikum doctors. In this video I'm discussing how can we take the history of ADEM, that is acute disseminated encephalomyelitis. So first I am telling the definition of acute disseminated encephalomyelitis is that fever for days due to viral infections or recent any vaccinations autoimmuno. The result after 14 days about 2 weeks come with hallucinations, fits, abnormal movement and ataxia. Okay. So again ADEM is that fever for days due to viral infection or recent vaccinations autoimmuno, then resolved, and then after 14 days about 2 weeks come with hallucination, fits, abnormal movements and ataxia. Now the history, the features of ADEM are the seizure, diminished sensations, tingling and unusual sensations, weakness of the arms, legs and face, back pain, loss of bowel and bladder control, coma and changes in visions. The task of history is like that 7 years old boy presented with uncontrolled seizure, recent change in mood and abnormal movement. Okay. So first history of analyzing the chief complaints. The symptoms started together or one by one. Describe the attack. Is it the first time or happened before? Usually the course is intermittent, improves and recurs. Before headache, abnormal any smell, feel, taste or lash of light. During how start, how it aborted. Duration, eye rolling, tongue pitting, pee, poo, loss of control, describe movement, neck stiffness, loss of consciousness, weakness. It can occur in front of witness or even without witness. After what happened? Confused, sleepy, weakness or abnormal gait. What about the triggers? Recent any infection, missing meal, lack of sleep, pain, nose, flash of light, cry, fever, free of symptoms, always in front of others. GDX of funny turn. So always in front of others, that is funny turn. Okay. So again I am chief complaint analyzing. First of all, symptoms started together or one by one. Describe the attack before, during and after. First of all, describe the attack. Is it the first time or happened before? Usually the course is intermittent and improved and recurs. Before what happened? Before any headache, abnormal smell, feel, taste or lash of light. During how start, how it aborted. Duration, eye rolling, tongue pitting, pee, poo, loss of control, describe movement, neck stiffness, loss of consciousness, witness, if can occur in front of witness or even without witness. Then after what happened, any confusion, sleepy, weakness or abnormal gait. Triggers, any recent infections, missing meal, lack of sleep, pain, nose, flash of light, cry, fever, free of symptoms, always in front of others. DDX of funny turn. And then general FWSL, fever, fatigue, preceded the attack by 2 weeks. Then CNS, increase in intracranial pressure, signs of weakness, bug, trauma, hemorrhage, shunt, behavioral or abnormal movement, depression, loss of interest to something what enjoyable before. Describe for me his gait, unsteady gait, vision and recent changes, hearing, affection of his sensation. So this is CNS is very important because they have weakness can develop, behavioral abnormality develop, depression present, and they have unsteady ataxic gait and recent changes occur vision. Also hearing. Any other concerns like dysmorphic features and chronic disease. Other systems review GIT, tummy size, tummy pain, poo, nausea, throwing up. If not the complaint, oral and anal soreness. Nutrition about number of meal, content in each meal, salt craving. CVS about heart racing, awareness of heartbeat, blood pressure, fainting with special posture. Chest or recurrent bug, musical sounds, chronic cough, sputum, night sweating. Urinary about the pee, color, amount, if more at night than before. Anyone measure his blood sugar, change of concern about the private parts, pigmentation. Endocrine about the thyroid, Cushing, salt crisis and numbness. MSK, skin spots, bruises, hypo or hyperpigmentation, swelling, lumps, bone and muscle pain, hair loss, abnormal hair distribution. Hematology about the pallor, bruising, bleeding and the bug. And past history as usual, we are taking 5T IOA plus radiation, bug in the brain, recent travel, medications. Puberty if relevant, perinatal nutrition, allergy as usual, development, all any loss of acquired skills, growth charts. Vaccination, COVID vaccine and recent any vaccination, very important. Sometimes ADEM is associated with vaccinations. Family history of autoimmune disease, consanguinity, social home, financial and psychological home, old pipes, old paint, schooler type, attendance, absence and bullying and impact. So differential diagnosis of this abnormal type of mood and sudden started. First of all, acute disseminated encephalomyelitis. It can be multiple sclerosis, acute viral encephalitis, a meningitis like aseptic meningitis, any Bell's palsy, brain metastasis, cardioembolic stroke, sting bite, brucellosis, pandas, SSP, subacute sclerosing panencephalitis, Lyme disease, cavernous sinus thrombosis and adrenoleukodystrophy. Now I am telling the features of this DD. First of all, acute disseminated encephalomyelitis. ADEM is that fever for days due to viral infection or recent vaccination autoimmune, then resolved and after 14 days, about 2 weeks, come with hallucinations, fits, abnormal movement, and ataxia. CSF, there is increased lymphocytic count and slightly elevated protein, but less than 70 mg per deciliter. Elevated levels of myelin basic protein, which is a sign of demyelination, but no oligoclonal bands. Multiple sclerosis in the first severe attack. CSF has oligoclonal bands. Acute viral encephalitis within 1 to 14 days, differentiated by CSF lymphocyte pleocytosis with normal glucose and normal or mildly raised protein. Aseptic meningitis, Bell's palsy, brain metastasis, cardiac embolic stroke, sting bite, that is recent TML we find. Brucellosis, pandas. Pandas is that pediatric autoimmune neuropsychiatric disorder associated with streptococcal infection. SSP, subacute sclerosing panencephalitis. It is a progressive neurological disorder of the children and young adults that affect the central nervous system. It is a slow and persistent viral infection related to measles. So previous measles history, vaccine taken or not, this is very important. We need to ask. Lyme disease is the history of travel, arthritis, erythema migrans, carditis, or cranial nerve affections. Cavernous sinus thrombosis, severe headache, swelling or redness around the eye with droopy eyelid, convulsions and coma. Treatment by high dose of antibiotic and steroid. So cavernous sinus thrombosis, there is severe headache, swelling and redness around the eye. Okay, and steroid and antibiotic we are giving. Adrenal leukodystrophy. So this is all about how can we take you disseminated encephalomyelitis history. Thank you.